turn the alarm off since we're giving a bed bath and she'll be rolling. We don't want that to sound.
Can you confirm your name and your birth date, please? Also check the wristband. Now, do you need any help? Or we can help you with a complete bed bath today? Or if you get exhausted easily, so we can hurry up and make it a fast process. So.
Alright, do you need to use the bathroom before we start?
Yes.
Okay. We're going to perform hand hygiene again.
We also want to lift the bed up so that we don't hurt our backs.
And then we'll put gloves on after hand hygiene.
Good. And while doing the bed bath, it's normally easier to lay them in the supine position. So we want to ask the patient if they have any problems breathing or lying flat on their back. And if there is no issue, then we can lay them flat.
And since she has an IV, we're going to make sure that it's intact the whole time and not laying under her. And then with the bedpan, you want the handle facing forward. That way it's more comfortable for her to sit on. Alright, Miss Beveridge, we're going to roll forward Felicia.
Reach over here, and on the count of 3, we'll roll you. 1, 2, and 3. We also would like to ask the patient if they want privacy, so we could either step out of the room and lower the bed, give her the alarm if she needs any assistance. So.
And we took our gloves off and performed hand hygiene again. Alright, Miss Beveridge, are you done using the restroom? Alright.
We're going to roll you back towards me on the count of 3. 1, 2, and 3.
Alright, and then if there's anything in here, you would perform care before you laid her back down. Okay. And if there was anything in here, you take it to the bathroom and record the output, because you have to always record the intake and output. And then I would take my gloves off after that, perform hand hygiene, and then come back and put gloves back on because we will start the bed bath.
And we will lay her flat because she doesn't have any problems with lying flat.
Yes, while she's... do you want to get the water?
Yes.
Alright. I'm going to take the blankets off. And when you take the blankets off, you want to make sure not to shake anything.
Or uncover her.
Yes.
And we also want to ask her, we want to first check the water with our wrist to make sure that it's not scalding hot or very cold. And we can also ask the patient as well if the water is okay.
Do you want to hand me the bath?
Yeah, let me just sit.
And we're going to set the blue blanket aside since she will use that comforter again.
To remain covered as much as possible.
And then the sheet will go in the dirty linen basket, and then we will take her nightgown.
It's a nightgown. And in this situation we have an IV, so we will once want to make sure that she's not laying on it, especially doing turns. And we will want, with her gown, we'll need to take it off, and through the gown we don't want to take out the IV.
And Miss Beveridge has headphones on, so we also want to make sure those come off before we start the bath as well. And for the purpose of the video, we're just going to reuse her Tet hose. There we go. Alright, then cover her back up. Do you want to hand me a washcloth?
Yes.
Thank you. Alright, we're going to go ahead and wash your face.
Inner corner to out, and then if they have any oxygen, you'll want to remove it temporarily and check around the nose and behind the ears if there's any sores or lacerations. And then right after, you want to reapply it, but you also want to check and make sure there's oxygen coming out.
Yes. And when you wipe each part of the face, you want to make sure that you peel back another corner. That way you don't spread microorganisms to other areas.
Make sure you get underneath the neck. And when you're cleaning, you'll want to make sure that you're not applying too much pressure. It can cause any skin tearing, so shearing or friction. All right. You can get the towels wet. And during the bed bath, you'll also want to ask the patient if they're doing okay, if they need anything.
We're going to move to the arms now. And when you start with the arms, you want to make sure that you uncover just the arms. That way she's still provided with some privacy and a little bit of comfort knowing that she's covered and not exposed.
We'll want to start at the hands and work our way upwards, and this helps with circulation and blood flow.
You want to make sure that you get between the fingers and under the fingernails.
And you'll also want to check for any pressure ulcers, especially underneath the elbow. Keep working your way up. And then lastly, on the arm, you'll want to do the armpit.
And then you'll pat everything dry, because if you rub it dry, you risk skin breakdown or skin tears.
You'll also want to change washcloth after doing the armpit area. Yes.
Alright, and then you're going to want to wash your chest. And with this, you're going to want to keep her as covered as possible so that way she's comfortable.
You also might want to pat underneath the breast rather than rub, as that skin can be pretty sensitive.
You want to dry her chest?
Yeah. There we go.
Alright, and then we'll move down to the legs.
Once again, want to keep as covered as possible. Are you doing okay, Miss Beveridge?
And as with the arms, you want to make sure that you start distally and go towards the center of the body to help with circulation.
Clean between the toes and under the nails. And again, you'll want to check for any pressure ulcers underneath, especially the heel.
And this again, you don't want to rub too hard because you don't want to cause any skin tears.
And again, you'll want to pat dry. You don't want to rub.
And you want to make sure that when you bring in towels and washcloths that you don't take in more than you actually need, because then they all have to be re-washed because they're considered contaminated.
Alright, so do you need any help doing the peri-care while we step out? You always want to make sure that you ask if they are able to do anything. Alright, we're going to roll you towards me, Miss Beveridge. Oh yeah, we can do that first.
Just for cleanliness, we're going to do the front first, because then we'll take what was wiped from the front back to the back.
And you'll want to do this as quickly as possible because they're probably uncomfortable, but in this situation, you want to go from front to back on each side. And every time you wipe, you want to flip that back, front to back, to avoid anything from getting up in the area. Cover her up, and then I will need to change my gloves, do hand hygiene, get new gloves, as well as change the water.
Yes, And it's okay for her to step away from the bed when it's raised because I'm still here and I can still take care of the patient if anything were to happen. Okay. All right, we're gonna do the back side now.
We're gonna roll you towards me, Miss Beveridge. Reach over here, and on the count of 3. 1, 2, and 3.
All right, I'm gonna start with the back, and I'm gonna go from the bottom of the back towards the top in a circular motion to kind of also give her a little bit of massage as we're washing her back. But you can always make sure to ask if she wants one. And then with the back pericure, just like the front, you're gonna use the one side, and then you're gonna fold over the corner and do the other side. Fold that corner over and in the middle. Okay, like that. And then we're gonna pat dry. All right. And then since we're done with the towels, those can go in the dirty linen closet. And I will go take the water and empty it out. And then take my gloves off, perform hand hygiene, and put new gloves back on.
And once again, with rolling, especially if they have oxygen or IV tubes, you'll want to, once again, make sure they're not kinked or she's not laying on them. And this one here. Like that over here.
All right, and then our next step of the bed bath is to provide clean linens. And so we're gonna change the bed as she's in it. And we're going to change the linens on the bed while she is still under the blanket. That way the soiled part is with the soiled bath blanket and we don't get it on her clean clothing. All right, Miss Beveridge, we're gonna go ahead and change your bed. We're gonna have you roll towards Felicia again.
And on the count of 3, 1, 2, and 3.
All right. And
Once again, you'll want to make sure that you're not shaking out any linens, and you want to roll up the soiled linens. And also when you roll the patient back, you would just might want to let them know that there's a big bump underneath of them so they're not shocked or surprised. Are you doing okay, Miss Beveridge?
And then you're going to push this folded back so it doesn't come in contact with the soiled linens. And you're also going to put a new soaker pad down.
And then also some patients like their pillow to be changed when they're rolled on their side because it's uncomfortable when they're on their back. So it's just best to ask the patient when we could change their pillowcase on their side or on their back.
And the pillowcase as well will go in the dirty linen basket. When putting a new clean pillowcase on, you want to make sure that you don't shake the pillow into the pillowcase. And then you're going to kind of turn it inside out a little bit in order to get it flush with the bottom of the pillow. How are you doing, Miss Beveridge? And since she's laying on her side for a while, you want to make sure that you ask just to make sure she's comfortable. Miss Beveridge, we can go ahead and roll back towards me over our big belt. And during that whole time, you want to make sure she's covered again for privacy reasons.
And again, the IV. Another good thing too is to assess where the IV is inserted, make sure it's not inflamed or red or if there's any infection.
All right.
I'm going to roll you that way. Okay.
1, 2, 3. sure when you make the bed that there's no wrinkles or anything, because that can cause discomfort or pressure in areas and cause skin breakdown. Alright.
And before applying or putting on her gown, we also have deodorant available, so we would like to offer that to the patient, whether they would like it or not.
So, Miss Beveridge, would you like deodorant today?
She says no.
No? Alright. And we're going to put on her nightgown next. And with this, we're going to make sure it goes on under the back blanket so she's still covered the whole time.
And the gown opens up to the back. And again, with the IV, you don't want to take it out. You'll want to take the bag off and put it through the arm. Yeah, so you can get her arm through here. You doing okay, Miss Beveridge?
Alright.
We're hurting.
And we are going to put on her tet hose as well before we take off the back blanket.
Another thing that's good too is to change the gloves, do hand hygiene, especially if the linens are soiled, visibly soiled.
And there's many different ways to put on tet hose. They're super tight anyways, so you're gonna maybe struggle a little bit. But it's really kind of how you are comfortable putting them on once you start your practice.
And also when applying the tet hose, you want to make sure that there's no kinks.
And you want to make sure that they go up as high as they can. And then we're also going to apply her non-slip socks. So that way if she needs to go to the bathroom or anything while we're gone, and she wants to get up out of bed, she's not going to slip and fall. And those just go right over the tet hose.
Such cute socks you have, Miss Beveridge. Gosh, this doesn't really go on that well either. There we go. Okay. No.
And after that part's done, you can go ahead and take your gloves off and perform hand hygiene. We're going to leave ours on right now because we're going to perform oral care shortly. But we're going to finish making the bed.
And once again, with the top sheet and the comforter, you'll want to make sure that you're not shaking, or when there's no kinks in the sheets, can cause discomfort.
Let's go ahead and take the back lid off of Miss Beveridge.
Once again, you want to ensure privacy as much as possible.
And since this is now soiled, put it in the linen basket. Alright, and then we will put on her comforter one more time. You want to make sure this is wrinkle free as well. And then you're going to pick up the
Corners, over here is the miter corner. So, and tuck everything else underneath.
and then you'll pull that little corner back down. Alright, Miss Beveridge.
You doing okay? Perfect. Once again, you'll want to check any tubing, kinking. This is very important. Now we will do oral care, and we'll want to ask the patient again if they need any help or if they would like any assistance. So once again, we'll do oral
Hand hygiene.
hand hygiene and then new gloves.
Yes. And we also want to make sure when we ask about oral or dental care, whether or not they have their own set of teeth, because that will provide a whole different set of tasks to be done.
And we want to set Miss Beverage up when brushing her teeth, doing oral care.
You don't want her to choke on anything. You want her to be able to spit the toothpaste and everything out when she's done.
Yeah, I don't know where those go up to. Do you mind holding this for me?
I would love to.
Yeah, the toothpaste. And when doing oral care, you'll also want to check for any lacerations or sores. Always doing assessments.
And same with denture care. If she happens to have dentures, when you take them out, you want to make sure that you're checking the mouth for any sores or spots caused by the dentures.
Go ahead and spit, Miss Beverage.
All right.
Perfect.
And
I will want to do hand hygiene again.
I have the dentures, and with dentures, you want to take them to the sink in the room or the bathroom, and then you're going to want to lay some paper towels down just to make sure that if it happens to drop, they don't chip or anything. And then just like regular teeth, you're going to brush them, make sure that all the food particles are out and the fixative is off, and then you'll put them back in a little container and fill them up with water. And then I too will take my gloves off and perform hand hygiene since we are done with our bed bath.
Next is to ensure the safety of the patient when we leave the room, so we will want to lower the bed.
Yes, and since we turned the alarm off for the bed bath, we're going to make sure that we turn it back on for her safety.
We will also want to give the patient the call light on the strong side.
Yes, and you want to make sure that these pads on the floor are secured at the bottom as well. And then before we walk out, we want to make sure we lock the wheels and declutter the room.
And then ask Miss Beverage if she is okay or if she needs anything from us. We'll see her later.
Yep. And make sure that you let her know where her call light is and if she needs anything. All right, thank you, Miss Beverage.
Thank you.